Participate, engage, speak out, use your voice to be an effective advocate. The Voices in Advocacy podcast examines the diverse landscape of advocacy, exploring the ins and outs of building influence, driving change, and creating champion advocates. It's now time for the Voices in Advocacy podcast with your host, Roger Rickard.
Hello and welcome to the Voices in Advocacy podcast. I'm Roger Rickard, president and founder of Voices in Advocacy, where we work with organizations to inspire, educate, engage, and activate your supporters by turning them into effective, influential advocates. And this is the podcast dedicated to the art of advocacy. This podcast is for the people that work and engage in advocacy efforts, be they for their organizations like corporations, associations, trade organizations, and nonprofit cause groups. If you're one of the people that work to build grassroots advocacy and grow your community of advocates, then you are in the right place. Now, let's get started. In today's episode, we speak with Kristin St. Deputy Director of the National Association of Community Health Centers, better known as NAC. She is responsible for the planning, implementation, and coordination of trainings and communication tools to expand NAC's Grassroots Advocacy Network and increase the impact of health center advocacy. Kristen brings more than 15 years of experience engaging and mobilizing advocates around healthcare issues. Most recently, she was the engagement counselor for the All of Us initiative at the National Institutes of Health. Prior to that, she focused on grassroots advocacy for both the Arthritis Foundation and the Pancreatic Cancer Action Network. Kristin, thank you and welcome to today's show.
Oh, thank you for having me. I'm still, I'm excited. I was very surprised when you reached out to talk. So I'm really excited about being here.
Well, I told you before we started the actual recording for the podcast today that you're my hero, as I've been diving into everything that you're doing at NAC and how you're doing it. I think you're a great example of a lot of advocacy in action. So let's kind of dive right into this now. Tell us about the role that the National Association of Community Health Centers. What is the role of the organization?
So basically, just like with any major association, we're kind of, I don't want to use the word umbrella, but that's like, unfortunately, the best description to use. We're almost like an umbrella that works with all FQHCs, that's federally qualified health centers, as well as also community health centers in the United States and territories. We do just a ton of stuff. I have to say, and this is not in a way to suck up to my coworkers, but it's amazing the depth of just experience and intelligence that are and creativity that's here at NAC, that basically folks who work with the with community health centers. It could be anything from our federal and state affairs people, our research folks, as well as folks that are in the departments, the training and technical part of the association and stuff like that. So we kind of cover everything to help out community health centers as well as primary care associations, just in the United States. And so it is definitely, when I got this position in the national, in the grassroots advocacy team, I was really excited just because of just the amount of people that we're helping.
Oh, that's excellent. So on your website, you host the Health Center Advocacy Network. And it says that you have 175,000 advocates. So what tools do you provide these advocates to make them even more effective and more influential?
Well, I believe, and I also want to say my team is amazing, or the folks that I work with here with the Grassroots team is amazing. We pretty much are flexible enough to provide whatever tools people need, but we have toolkits for different issues. Like right now, obviously, you have the COVID-19, so we do have a toolkit with that, especially that was even from last year when it just kind of was like a hurricane that came through like our neighborhood or a tornado, of trying to deal with that and provide that. We have toolkits about 340B issues. We have toolkits, I'm just thinking off the top of my head, we have toolkits with telehealth, and stuff like that. So it's basically what we try to do is provide pretty much everything, talking points, sample letters to the editors, op-ed. We provide, we work with, our research team to give people really cool graphics that have statistics, because you always say, especially on social media, people like pictures and videos of kittens and dogs. So it's like everyone likes to see stuff. So with a lot of this, we try to do infographics that folks can kind of digest, and basically also give them the, just the, I don't want to use the word instructions or directions, but giving them tips on, making sure you tag your member of Congress or an elected official in your area when you post something so they see it, or, make sure if there's an article from your local newspaper that the article is awesome and it talks about just the great things that your health center is doing or what you're dealing with, making sure to, retweet it, or, and tag the reporter, make sure that the newspaper or the media outlet sees that article. So, or that
give it legs.
Yeah.
How to give it legs.
Yes. Yeah. So thank you. So, so we try to do that, and also just to provide, we have we have like a sample calendar, just to kind of give people a heads up for like the year of, different things that are coming up, so they can do planning, like, so everyone knows that National Health Center Week is coming up in August. So, putting that on the calendar, as well as, election days, so they know, when to kind of sort of stop engaging with officials that are up for election, so they don't get in trouble, and, and stuff like that. So, we try to provide as much as possible.
Do you ever instruct your advocates to invite members of Congress and the elected officials to the community center to see the work that they're doing?
Oh my gosh, yes. Yes, that is a huge push. Was really interesting was last year with COVID, we thought we were gonna, for a hot second, we actually debated about canceling National Health Center Week. And then we took the theme that was originally picked for last year and kind of pushed it aside, came up with a completely new theme. Basically the, community health centers are the light, they light the way to a healthier community. And so we were trying to figure out ways to do it virtually. And, I will say this, health centers, gosh, they amaze me with just different ways that they can be so creative and, and really figure out ways that they could have elected officials from local to federal visit, whether it be a FaceTime or doing a video and posting it, or having, meetings in that way as well. So, that is definitely a push. So just to make sure, because a lot of people, I'll be honest, I did not know, or what I was not, and I'm still not an expert of community health centers, but I didn't really know all the depth of community health centers, even when I first got this job. So, and I work in it, you know what I'm saying? So, even though, because everyone says you look at one community health center, you just see one community health center. Every community health center is completely different.
Yeah.
And, people have different experiences and may not know that this one particular place, because it does not have community health centers on the, as in their name, is a community health center. So it's, pushing people and encouraging people to, basically advocate for their health center, which is really talking about it.
And plus, you've got to have a constant educational push to alleviate the biases and the prejudices that may exist without their knowledge of really knowing what all transpires there. Now, I know that you hold a couple of national days of action throughout the year.
Mm-hmm.
Are the tactics that you're talking about, and you've just talked about, is that really the purpose of the days, is to try to focus in on a given days and ask these community health centers and their staffing to speak out, and the patients that use them?
Yes, actually, these started last year. We did have, so the year before, I always say like 2020 doesn't exist in my mind. I was like, yeah, last year, 2019. But in 2019, we were trying to figure out a way to encourage this community health centers to actually also focus on visiting their member of Congress in their district office. So we did something like that. We did a day that was a huge push to, to make sure. And I got that from a previous job when I was at PanCan. We really encouraged the volunteers, because they, to make sure to visit the district offices regularly, like 3 or 4 times a year. And that's like minimum, to become, because that's your connection to DC, is that office in your neighborhood. So we started with that. And then we're like, it's pretty good. People were kind of like, not too sure about it, but they did it. And then we were, getting ready to plan something for, in 2020, and then COVID. And so, as you probably know, and everybody here, everyone who's listening, it was insane the first, I would say, 6 or 7 months, just the amount of emails that were going back and forth, like even just work-wise, because everybody was home. And so what we were trying to do, and this was kind of in a response to talking to health centers as well as primary care associations, is trying to figure out, instead of constantly hitting them, because we were in, it was really scary. There were some health centers that were on the verge of shutting down. There was, us getting funding, our federal funding was, kind of, that still hadn't been properly secured. So it was kind of crazy. So what we did then is basically always have the option to send a message to your elected official on and open and updated on our website, but 1 day a month. And we scheduled it. We were going to focus on something specific. And so that people knew, okay, second Tuesday of every month, I need to sit down and write, a letter to our member of Congress.
And we have a specific target of what we want to achieve in that given month. So your grassroots team, and I love the fact that you're sharing that it's the teamwork that goes on there. You produce a weekly Washington update. It's a podcast, which is very informative. I've had the opportunity to listen to a couple of them. What type of content do you provide in that update, and then where do you push it out? I mean, how do you push it out?
Sure. Yeah, and that was another COVID response. Because it was one of those situations where we would be getting emails or phone calls from the field, like, well, where's this? Where's that? And be like, we kind of mentioned it in the Washington Update, which is a weekly newsletter that we do. So like Tuesday evenings, we kind of push out to everybody on our listserv. Just basic updates from our PPR divisions, Public Policy and Research Division. So we receive updates from our state, federal, and research all those folks kind of, and then we share any news that, just as examples of stuff that's going on and how health centers are responding to it, or how health centers, manage to get a big article on a website and stuff like that. So, we try to provide that, and then also give a heads up to any trainings that are coming up that are public policy and advocacy focused. And of course, if there's, something that would interest them that may not be, we work with other departments. They send stuff, every once in a while. It's like, hey, if this can you throw, can you put this in? So from there, my a former colleague from our comms department in NAC said, well, kind of let's meet the advocates halfway. Have you guys thought about just doing a 10,000-foot look, 10,000 feet, you know what I'm saying? like a wider look at what's in the Washington update, but, in audio form. So we were like, as long as we don't have to record, like videotape it, we're good. So it was really cool, because at that point, all of us we had just started it. We were just about to start it when we all shut down. So we used Teams. And at first it was, my coworker, Susan, Shamal, Marie, and I were doing it. And then Susan's my director, she kind of stepped back. And then it was Shamal and Marie and I doing it. So every week, like Tuesday night, it goes out. Wednesday morning, we get a script, and we record it after our team check-in. And Marie, bless her heart, she learned how to edit it. And once it's edited, we do the Bitly link, and then she sends it to me, and then I go ahead and put it on LinkedIn, and the HC Advocacy. There are HC Advocacy handles on Facebook and Twitter, and then I usually throw it on my personal stuff so people can have a good laugh.
So in there, you talked about providing maybe some education updates or some trainings in it. So other than through that forum, how do you educate your advocates, and are you still in a position where you want to grow the number of advocates that you have?
What we try to do is we have the advocacy learning program is one aspect, and we have cohorts of that. So what we try to do is it's twice a year, and it's usually tagged on to two of our big conferences, CHI, which is Community Health Institute, that's in August, and P&I, which is our policy and initiatives, and that's here in DC. Well, usually here in DC. So what we do is, no more than 30 people can sign up, and we have an extensive half a day of training. And then we do once a month, traditionally once a month, we would have like a new webinar that'd be posted for them, to participate in. What we did this year, we had to cancel it last year just because of the craziness. So this year, what we did is we actually had it, even though you would sign up for it through P&I or through the big conferences, it's separated. And what we did is, because of also equity, to make sure that everybody can, who's interested, not necessarily people who would just be going to these particular conferences. We did it completely virtual, and then recorded it. And so we actually have, I don't know if you've ever heard of NoddlePod. NoddlePod is kind of, it's like LinkedIn, Facebook, but for something very specific. So like we have it, our training department actually has it so that you have all these different little sections of it. So we actually have our own page on it, in which we post all the information. And then I've been doing monthly. I've just started doing it monthly office hours. So I have something today. So we have an hour. I will be on the Zoom. You guys come and talk, and we can answer questions, talk amongst yourself. And then we also, a part of ALP2 is that for you to be an ACE, we have a Advocacy Center of Excellence. And that's, we have a bronze, silver, and gold level for the health centers, and being participating in ALP is one of the requirements. So, and the ACE thing is basically to help encourage advocacy as a as something that's in your whole health center, that it's not just the C-suite. It's basically, anybody can participate, and anybody can, send messages to their elected officials and become an advocate. So as well as patients, and stuff like that. So it's really kind of cool how some of the ideas that the folks who are involved with ACEs, how they get people geared up and ready and educated, and then anything that they need, if we can produce it, we get it to them. And because I always say, ask, because if you're thinking about this, there's probably at least 10 other people who are
right. I agree. So what are the if you had to narrow it down, and it's always difficult, but let's try to narrow this down. Mm-hmm. What are the two most critical initiatives for the organization over the next 12 months? And when I say initiatives, that could mean, what are your two largest priorities with Congress? It could be even more general than that.
Oh, wow.
Oh, I stumped her.
Yeah. Well, I'm just thinking, because I mean, just being on, obviously, oh, yikes.
Well, let me rephrase it then. Let's take a look. Let's take a look at this for a second.
Okay.
The president recently addressed a joint session of Congress.
Yes.
And he had a long list of legislative proposals.
Mm-hmm.
Has your team and the organization had time to figure out if any of those proposals will have an impact on NAC, on the health centers, and if so, what do you plan on doing with that, or you're not quite ready there yet?
I think people are still digesting, and I've in meetings, may it be our divisional meetings or our full NAC meetings, there's just a lot going on. I think right now the main thing is to we did receive the federal funding for the next couple of years, so that is good. And it's not, as we were saying to folks, that yes, we should celebrate this win, but at the same time, we need to, I think there needs to be almost and this is me personally in my just thinking of stuff that's coming up, is to continue with the education campaign, where it's not just education, it's not us educating people how to advocate, it's more of us educating as to this is what health centers are. Because the amount of, and I'm just so happy with the with how folks are recognizing, just the role that health centers are playing in their community, and have been for, we're going on 50 plus years now. But especially once the vaccines started, how, everybody was kind of leaning on and loving on health centers, just because they're small enough to actually move and actually figure out ways to reach out to their communities on a quick basis and what's needed immediately. That's what health centers are for. That's why health centers are there. So I just think right now it's more of kind of letting people know that, hey, you came here for this vaccine. Oh, you've never been here. This is what we have to offer. And this is why health centers are so important, just to the, not only to the community on a healthy, on that type of basis, working on a healthy community, but in the fact that they're economic engines for the community as well. I mean, the amount of money that goes into health centers, even like federal funding or not, it comes out, even more because of the money that not only with them buying supplies and stuff like that,
jobs.
The jobs, but you also have doctors, nurses, frontline people who are going to eat out or go and do this and do that in the community.
Right.
So I just think that's, for me personally, because I always kid around with my friends, it's all about me, is just, making sure that, folks understand the community health center's place in the world, in their community. And that's, trying to kind of, sometimes you have to start at square one.
So as you talk about their place in the community, it reminds me of the fact that oftentimes the layman believes that advocacy is just literally government affairs, that it is just with elected officials. But you've got a number of other stakeholders, and you've alluded to it at different parts of today's conversation, where you've talked about media, and so you've got the public that need to be educated, that are stakeholders in this, the patients that are stakeholders in it, the media that is stakeholders in it, local governments, local regulators, state, federal levels. I mean, you've got multiple layers of that. And so let me turn this into a different direction now, because you've got all of that in front of you. Kristen, to you, what is the most challenging part of your job?
Being mature. No. Sorry.
Well, we're all in that boat.
I think one of the most challenging parts for me is explaining that advocacy isn't just going on Capitol Hill, and advocacy isn't just asking for something. Advocacy is sharing. Advocacy is educating, and from there, that's where you get your support.
And I often say when I speak to groups that advocacy is a positive word. When you actually look at the definition of it, it's pleading in favor of, it's supporting something else. So it's not being the negative don't, it's the please understand and do kind of aspect of what advocacy is. And to touch upon what the different stakeholder groups is, I have what I call the 7 action, or the 7 branches of the advocacy tree. Now, government affairs is just one of those. But you've got media, you have got industry, you've got public service, you've got people, there's all kind of aspects within that list of 7 that help broaden and kind of fill out the whole advocacy tree. And most people don't understand that. But I'm going to close with a question that's going to gear us back towards government affairs a little bit.
Okay.
Well, now I'm going to do two things. What do you think when you hear the word advocacy?
I think when I hear the word advocacy, I hear intention and emotion. Those are the 2 things I think about when I hear advocacy.
That's excellent. Nobody has ever answered it in the same way that you just did there. That's pretty awe-inspiring and eye-opening. So now let's take a spin towards the government affairs side of things for just one question. In your opinion, and this will all be personal here, how can organizations and their advocates get anything done, move any legislation, when we are viewed as a polarized and divided country and Congress?
I think we have to be vulnerable. I can't even say that word right, but I think, here's the thing. Every person that walks this earth has a story. And that story that they have, whether they think so or not, has an emotional aspect to it. And that one, even if it's just one person, will connect to. So I think when this is a conversation we've been having with, sorry to take a quick left turn. So our boards for community health centers, half the board has to be a patient. So, and that was very intentional when community health centers were fixed up. And, when, we're focusing on working with the patient boards to reaching out to these people, because there is a story there as to you're a patient at this community health center and you're on their board. There's a reason why that you have that connection with the health center. And I think, just thinking of that in general, is to, I'm not an emotional person at all, or at least in public, but there have been times where when I was at the Children's Hospitals Association, or when I was with PanCan, or even when I was with the Arthritis Foundation, when I was working with patients, with people that were affected by whatever, where I've had to walk away. Because I'm just like, I'm going to cry. Because when you hear their story as to, this person, when you talk to parents of children with multiple serious medical issues that are coming to ask, basically ask Congress for help with Medicaid for kids or CHIP and stuff like that, and why that because of this particular program, my child is breathing right now, and thank God for this, and blah blah blah. And when you hear that, it gets to you. And that's what we always tell people. The stats really, the stats are great. Focus on why this is important to you. And I can only think of maybe 2 or 3 Hill staff that I've been in a meeting where I'm like, are you human? Because I'm choking up and you're just looking dead on. But I think it's the personal story. It is putting your personal story out there and knowing and believing that people are going to, that they will protect you back, that you're not going to get caught out there, or that you're able to share this as to why, and people will respect that and protect that story, and hopefully use it as a reason to actually move the needle and respond to the situation.
Well, personal stories have a huge impact, and they have the ability to cut through all of the noise. So any final thoughts you'd like to add?
If I'm assuming I'm speaking to my fellow grassroots advocacy people, or grassroots public policy people, is just first of all, hey, we made it through a crazy year, an unprecedented year. There were silver linings, few and far between, and just keep up the good fight, and also, it's all right if we're vulnerable in a situation as well, especially if we need to share a personal story to our volunteers or our fellow colleagues, so that they can understand what we're talking about and why this is important.
That's an excellent point. Kristen, how can people reach NAC for more information? And that's NACHC. NAC.
Yes. So NAC. So we have two avenues. There's NAC NHCHC, that's on LinkedIn, Facebook, and Twitter. And then you have the Health Center Advocacy Network, that's HC Advocacy, at HC Advocacy on Facebook and Twitter.
Excellent. Well, that's a wrap up of today's great conversation with Kristin St. Deputy Director of the National Association of Community Health Centers. Thank you, Kristen, for being on the show today and sharing your expertise.
Oh, no, thank you for letting me come and crash.
That sounds wonderful. Till then. And now it is time for the Advocacy Engagement Tip. We always talk about having our advocates communicate with their elected officials. And to be effective in doing this, one has to learn a few guiding principles. Today's principle is to always tell the truth. Legislators rely on you for good information. If you want to be credible, you must be truthful. If you don't know the answer, say so. If you say you will follow up, do it. But in all cases, always tell the truth. Do you have a program to train and onboard your new advocates or reinforce advocacy best practices and principles to your existing grassroots advocates? We are proud to have Rap Index as sponsor to the show. Let's face it, today's advocacy arena is just plain noisy. Organizations are stretched. You need every advantage to make sure your issue gets the attention it deserves and your voice heard. The Rap Index is the best way to do just that by finding your stakeholders' relationships and engagement power. Get past the noise. Know who your people know. Go to rapindex.com. That's RAP index.com and tell them Roger sent you for a special offer. A few quick notes to end this episode. In upcoming episodes, you will be treated to great interviews from leaders in the world of politics, associations, and nonprofit causes. If you like today's podcast, head over to where you find your podcasts and subscribe to the Voices in Advocacy podcast today. A big thank you to today's distinguished guest. We at Voices in Advocacy work with organizations to inspire, educate, engage, and activate your supporters by turning them into effective, influential advocates. That's it for this episode of the Voices in Advocacy. Remember, you have the power to be an effective, influential advocate. Now go out and make it a better world.
We hope you enjoyed today's Voices in Advocacy podcast and look forward to you joining us again next week. To learn more about Voices in Advocacy, go to our website, voicesinadvocacy.com.